Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? I'm a vet. A few years ago I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. Me, what do you feed the cat? Owner, online trendy raw food brand. Me, how is his appetite? Does he finish what you feed him? Owner, yes, he always eats everything. Me, how much do you feed him? Owner, 1/2 cup. Me, once or twice daily. Owner, once every 3 or 4 days. Me, you only feed your cat twice a week. Owner, I believe in a more natural feeding approach, and based on my research that's how often cats eat in the wild. This owner was slowly starving his cat to death, based on some cockamamie idea he'd made up watching National Geographic. I had to explain to him that domestic cats are not tigers and that small wild cats eat 10 to 20 small meals daily. Surprise surprise, the cat's lethargy and weight improved with regular feeding. I'm in the so many stories. The one that left me dumbfounded was a woman was brought in by her sister for pelvic cramps. Amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause and her sister staring at the ceiling, I told her no, because they speak Portuguese in Brazil. Patient seemed relieved, and the sister hustled her out of the before I could discharge her, because they speak Portuguese in Brazil. Oh my god, to be a fly in that room must be epic. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem, just to keep him barely alive. This was explained ad nauseam to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way, so on and so on. Literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside our M/fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years, and I still see the wife around town. She always glares at me as if I'm the one who killed him. Rural doc here. 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to 10 minutes later. Oh yeah. And I accidentally swallowed a bee, and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Saw a chart once where a person came in for a burn to their eye. They told the doctor they read online that warm milk in the eye can help with irritation, and their eyes were irritated, so they boiled milk and then poured it in their eye. Burned it all. Optometrist here. If I had a nickel for every time someone said they use urine for eye drops, I would have $0.10, which is not a lot, but it's weird that it happened twice. Had a patient come in for facial burns because he smoked while wearing his oxygen point twice in the same week. Just had a man die to this in March. https www.wabi.tv/2023/03/28/ deadly main fire caused by man smoking while oxygen ruled accidental / he had burned down his home the day prior and then proceeded to burn down his friend's home and die. Thankfully the friend survived. Not me, but my wife, who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog, that he wouldn't be able to breed it. As someone who worked at a vet office, I'm completely unsurprised. We once had to explain what smegma was to very embarrassed owners of a new puppy who brought him in for discharge around his penis. Not to mention the countless people who bring their cats in asking about a lump, only to be told it's a nipple point, and then you occasionally get the inevitable, but he's a boy, and have to explain that male mammals have nipples too. Like, ma'am, you are married. Have you never noticed your husband has nipples before? I miss working there. This happened in med school on my ob/gyn rotation. Patient, who's the baby gonna look like? Me. What do you mean? Patient, what is it gonna look like, the dude who got me pregnant or the guy who's been nutting in me the last few months? Me. Utterly speechless. The baby should look like the people who conceived it. This person is now a parent. Edit. Fixed a typo. So, you're lactose intolerant? Yes. And you knew this before? Yes. And you drank a milkshake? Yes. What size? Large. The rest of the night was the kid screaming and groaning in the ed waiting room. Had an adult male patient who needed a Farley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, well, he's still a virgin, and I'm not sure I'm comfortable with his virginity being taken in a hospital. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back, heal and come back. Turns out she would jam out on like 3 bags of salt and Weingart chip a day for weeks at a time until the sores hurt too bad to continue. Then she'd go to the doctor. I worked there for 10 years. Every day people come in, and it shocks you how they managed to evade death for that long. One of the worst was we had a guy come in. He was a twin. He told us he needed to get checked for STDs because his sister apparently just got one. We of course had to ask if he has had sex with her, and he said no, but they were twins, so what she has, so does he. After a collective sigh of relief that this wasn't some weird Alabama "you're my sister" we had to educate him. That is not how it worked at all. Not me, but my mother would pick up shifts as a nurse, sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like, no clue. My mom usually said something like, how you got it in is how it's coming out, honey. This was the late 90s, early 2000s. I'm a social worker, and one of my clients literally kept getting pregnant over and over after having kids, and I had a frank conversation with her about birth control or getting her tubes tied, because she kept going through horrific births only to get her kids taken away. And she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnant because she was sexually abused as a child, and her father told her that she could only get pregnant when she's in love, and she had never been in love, so she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was having her get pregnant. Edit. Typo. Had an 18 or 19-year-old girl come in my OR with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that, whether it's halfway in or all the way in, sperm travel. What do you call guys that use the pull-out method of birth control? Fathers. 73 here, former clinical microbiologist. Long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife, and mom in tow, walks in with a paper request for semen analysis. Pre-computer era. Okay, not the most comfortable encounter, but I'm a professional, and did this drill many times. He had not been briefed by the doc, and had no idea how establishing infertility in males was done. Well, okay, a challenge. Then, I took him aside and, using standard medical terminology, told him how a diagnosis is made, and what he needed to do to provide a specimen. He couldn't/wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again. and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back: patient provided improper specimen. Optometrist here. Patient booked in for an emergency appointment with a raging red eye. Clearly very painful. Look under the microscope and the cornea is really not happy. Wobbly reflexes, haziness, the works. Me. What happened? Patient. It's my niece's wedding this Saturday and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding. Light blue. So I use the same dye for both to match the color. Me. Does that hair dye contain ammonia by any chance? Patient. I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me. Unless you can canvas them to change the color scheme to red. No. Edited because I read a comment about healing crystals and now I remember a story from a colleague. Patient attends a routine test complaining of gradually reduced vision, which turns out to be due to cataract. My colleague offers referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later came back for the referral. Second edit for remembering the first story. That made me question my sanity. Elderly patient attends with concerned family members because the patient ran over a pop-up tent in the side of the road that the telephone engineers used to protect themselves from the rain. Luckily no one was hurt as the worker was on lunch. Worried as to how the elderly driver missed seeing a large red and white tent in the middle of the day. It was then that the elderly relative admitted to having spent the last 3 years driving from memory. Him never leaving my house again. M's here had a diabetic in his 40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar is only read as high, meaning it was over 700 for glucometer. To not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice seam I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the door to rip off his bandage covering his fourth and play with the fourth wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. Former practicing surgeon. Male came in with a small bowling pin up his backside for the 3rd time. The old 3-strike policy. We've all been there. One day you're playing naked bowling with the brothers and whoops, you trip and fall on a looped up bowling pin at just the right angle to enter Uranus. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the and got sent over by my boss. When I got there the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and I didn't use any drugs. Then I smelled iron in the air, and then I found out there was blood all over the hallway. Handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter causing arterial bleeding and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before. That day nor after. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a Passamaquoddy to solve the problem. Everything goes normally and as planned. He recovers. Every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years until he shows up without formal warning and asks to talk with the doctor that did the procedure to put his Passamaquoddy. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the passamaker that should have been kept inside his body, dangling outside of it, being held by the left bra cup with a big infected open wound above it with the passamaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis or any other health problem that may appear for that matter. TLDR. Man gets a passamaker, doesn't show up to appointments, 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months to serve as a holder for the passamaker that got out of his body from his infected open wound. It is insane how sometimes people die because of a single knock to a certain part of their skull, and then other people will have an infected open wound leading to their goddamn heart and only get concerned after a few months. Hey yeah doc, I'm carrying all my organs around in these buckets. Do you have anything for when my hands get tired? I overheard a conversation between a nurse and a doctor and a patient in the ER. They were trying to figure out if he was very stupid or has a head injury. It was both hilarious and sad. He kept telling them that he was there for a hurt leg. He couldn't explain why his leg was hurt, how it was hurt, how he got there, nearly anything. I heard them taking in a hallway to each other. The nurse was convinced he hit his head. The doctor said no, he is just an idiot. Turns out the doctor was right. They go a hold of the guy's wife. She basically told them in the hallway he is always this dumb, and if she leaves him, he would get lost in his own house and starve. It sounded like his leg was visibly injured or swollen, but when asked what happened or how does it feel, he gave nonsensical idiot answers, not like slurring, but in a regular idiot voice. If feels hurt, I was talking to Jimmy and we were doing our usual work and my leg hurt. Doc, did something happen? What is the work? Him, something always happens. You know how it goes. I just want my leg fixed. Sadly, I once went to the ER with my mom. It was a minor thing. We good. And there was this old lady that asked my mom, "How long have you been waiting for? I'm only here for my nails and hair. It should be quick." My mom replied that it shouldn't take long, but I could see her holding up tears since this old lady was alone and confused and she couldn't even understand where she was. We talked with a nurse and someone helped her, but it was pretty sad to watch. This was one of the funniest yet cutest one. Was a student doing a shift in andrology/reproductive health. Doc, so you're trying to have kids, but not managing to. So do you have any other kid? Patient, yes doc, I have one. Doc, okay, so we need to do this and this and that. Patient, okay great. Then he proceeds to visit him and stuff, after which he goes away. After a couple seconds he knocked the door again saying, "Hello doc, my wife told me that it would be relevant to you that the son I have is adopted, but that makes no difference to me. I always considered him my own son." A woman called 911 because a cougar attacked her cat. She thought we could help the very clearly dead cat. A man called 911 because a cow bit him. He didn't want EMS or an assessment or anything. A man called 911 for an itchy butthole. Took him to the ED because we have to. The doctor asked the patient if he had put the cream on his butthole that he gave him last time. Patient said no. Next time patient called us for his itchy butthole, I offered to put the cream on his butthole for him. He declined. Took him back to the addition. I've been a firefighter for 18 years. People call 911 for the dumbest shiver. The following are all real 911 calls I've personally responded to. Toilet was leaking. Found corn in their They admitted to eating corn. Cat in a tree. They threw up. They had diarrhea. They had a very mild cut on their arm. They didn't have a ride for their routine DR's appointment. A bat got into their house. They locked their keys inside the house. They wanted us to change the batteries in their smoke detector. Their poop looked weird. They ran out of drugs and wanted more drugs, not the legal kind. And the guy who takes the cake, the guy who called 911 to say he was choking, he answered the door high as a Georgia pine with a lit joint in his mouth. I asked him who was choking. He said, calmly, he was. He said he swallowed an ice cube and now he couldn't breathe. Just to be sure, and partly out of morbid curiosity, I looked in his mouth, then asked him to take a few deep breaths, point which he was able to do easily. He still insisted he couldn't breathe, so I told him to make a pot of hot coffee and then drink it. He asked me why. I told him that the coffee will melt the ice cube. and he'll be able to breathe again. Oh, cool. Thanks, man. Then I left. If there's one thing I've learned in my 14 years as a Redditor, it's that if a man touches his butthole, even to wipe, he's totally gay. I'm so straight. I don't even sit down to that'd spread my cheeks, and that's gay. So, like any red-blooded, manly man with testosterone, I just standing up with my cheeks clenched tightly. I'm a nurse. This isn't about a patient, rather than my dad. He is convinced that insulin is what is giving people diabetes, and doctors are prescribing it just to make money. After 30 minuets of telling him why that's wrong, he said not to be so liberal, and I didn't understand, because I'm not a doctor. ENT. Father-in-law does his own research, and has tried to tell me on multiple occasions that any time we have to transfuse blood on the bus, we should ask the patient if they're vaccinated. Cause if we transfuse blood from someone who has the COVID-19 vaccine into a patient that hasn't had it, then it could alter their genetic makeup and keep them from getting into heaven. I work in clinical research at a hospital, basically for patients who have cancer and don't have other standard of care options. Clinical trials, experimental treatment are a viable option for many. Some people have a negative view of research, but it's highly regulated and not as scary as it sounds. We go through the consent form with this patient who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know is that using coke while taking this drug will make your heart explode. In layman's terms, this patient promises they are off the sauce and that they totally won't do coke while they are on the trial. 2 weeks later they relapse, and, well, you can figure out the rest of the story. Spontaneous heart detonation is a serious condition. If you or a loved one have been affected by spontaneous heart detonation, please reach out to Hamlin McGill immediately. Woman comes in with no prenatal care to labor and delivery in labor. OBGYN resident taking a history. Do you have any allergies? Patient: yes, I'm allergic to water. Resident: okay, what kind of reaction happens when you drink water? Patient: oh, it makes me pee. Yeah lady, that's a feature, not a bug. I'm stealing this to make every future doctor laugh.